with that falling number of active cases, as well as the relatively low number of new cases, I can report to you that the strategy is absolutely working, and there's no greater evidence of that or marker of that than the fact that the 14-day rolling average to 29 September in Metro Melbourne 16.4 cases, in regional Victoria just 0.3 cases per day. Now I do just want to make a comment that whilst the active case numbers, they're falling, and let's hope we can get below 300 for the first time in a very long time when tomorrow's numbers come through. But the most important thing here is, whilst people are free, of course, to make comparisons with other states and the number of active cases they had in a historic sense and what they might or might not have done at that point, it's really important, I think, that we just focus on that 14-day trend. If you pick a moment in time when another state, say New South Wales, was at about 300 or 350 active cases, that's not really a fair comparison at a point in time when we have 300 or 350 active cases. You've got to look at that 14-day trend that got you to that number. And we didn't have the sort of opening up that some people are urging. I understand why, but I also understand that it's not something we can do at the moment. We're very close. We've got 3 weeks to go before we can take big steps. But the notion of opening up at 16.4 cases per day in metropolitan Melbourne is not safe, it is not steady, and it will not last. I know these numbers are coming down, that's a great thing, and the temptation always is to perhaps read more into that than is there. You've got to do this in a steady way, and 16.4 cases, whilst it's the trend is with us and it's a fantastic result, that is not still low enough for us to be able to take those really big steps. The good news is, though, our modelling from multiple sources, as well as the actuals that are fed in every single day, confirm for all of us that we are on track, and all things being equal, we will be able to take a significant step in just 3 weeks' time. We're so close. It's a testament to the resilience and the commitment of every single Victorian, and it's something that we have to preciously guard so that we don't do too much too quickly. That would not be safe, that would not be steady, and that would not be lasting. And that's the last thing that anyone wants. There are 147 active cases in aged care facilities, or linked to aged care facilities, and there is just one active case in disability facility settings, and that is a staff member. Now, just on aged care, and this is the perfect pivot to Jerome to talk about surveillance testing across a number of different settings. Our officials have reached an agreement with the Commonwealth to ensure regular testing of Victoria's public and private sector aged care workforce. Public health services will test all public aged care facility staff. They're often co-located and are linked to public hospital services. Aged care is but one part of the clinical mix in those settings. The Commonwealth will test all private aged care facility staff using a private provider. Metropolitan aged care staff will be tested every fortnight, so around 50% of the workforce a week. Regional aged care staff will all be tested every month, around 25% of the workforce a week. If a staff member, and this is very important, if a staff member is asymptomatic and not linked to an aged care outbreak, which can be just a single case of course, they'll not be required to isolate while they wait for their test results to come through. That's in line with the standard practice around asymptomatic testing. But that's essentially making sure that over each 2-week period, we've got a really significant sample of aged care staff in Melbourne, in the regions, in the public sector, which is a big part of our overall aged care sector, and also in the private sector, which is the vast majority of those beds, of those facilities. That's just a really good way to monitor and achieve, if I can say, 3 things. 1, finding any coronavirus cases that are there. 2, validating that there aren't coronavirus cases there, and that's very important given how wildly infectious it is and how vulnerable many of the residents in these aged care settings are. And thirdly, it provides us with a really important opportunity just to monitor compliance with all the other COVID-safe planning and to make sure that everybody's being as vigilant as they possibly can be across all sectors to manage what is an underlying risk, a risk that will be there at one level or another until, of course, we have a vaccine.